Back, everyone. Studies show veterans often have unique health and mental health needs, but navigating the healthcare system after military service can be a challenge. It's why the Texas Veterans Commission has an advocacy department to help vets get that care that they need. In fact, in the last fiscal year, state data shows they closed more than 16,000 medical cases for veterans.
So joining us today to talk much more about that process, as well as some of the challenges that might emerge, are two guests, Gary Lee, Marine Corps veteran and the Commission's Healthcare Advocacy Director, and James Juarez, a Navy veteran and a healthcare advocate for our Austin region. Welcome to you both. Thanks so much for taking the time to be with us here today.
Thank you for having us.
Yeah, I want to get started with you, Gary, and just talk about what are you hearing from veterans about some of the things that they experience trying to get the care they need.
Okay, thank you for that question. For the past several years, there's been information out in the media that it's difficult to deal with the Veterans Health Administration. They're a wonderful organization, and they've worked with us and our legislature and our Texas Veterans Commission Executive Director, Mr. Thomas Palladino, the Vision 16 Director, Dr. Jones, and created something that's unique to this country. Only Texas has a state healthcare advocacy department that works hand in hand with the Veterans Health Administration to try to address some of the challenges that they run into. We understand the VA is a large organization, and sometimes they get frustrated. And rather than just walking away, not receiving the care and treatment that they have earned and that they deserve, we are another avenue for them to have their concerns heard. We speak on behalf of them to the Veterans Health Administration once we have a signed authorization from them that we can discuss their health care concerns with the VA and try to find resolutions to the issues with which they are dealing.
And James, I know that that's a part of your work directly as a healthcare advocate for the local region here in Austin. So what are some of the things that you hear from veterans who are asking for your help, if you can share a little bit about that?
Yeah, thank you. So one of the things that veterans, when they come to see me, the first thing I do is I listen to find exactly what it is they're experiencing and what the issue is. Once I confirm that that issue is, sometimes it deals with medical billing, community care referral, or trying to get an appointment with their primary care physician, or just prescriptions. So once I confirm that that's what their need is, then I work through the VA system, through the resources that I've developed, and I find them the answer they're looking for.
What kind of successes have you seen and better outcomes when folks are utilizing advocates like you rather than just trying to go it alone and navigate what can be a confusing system?
So for me, I'll answer that. So one of the things here in the Austin area is I've done a great job saving veterans money through medical billing. That's a lot of times where a veteran goes to receives care in the community, and for whatever reason is the community provider doesn't bill the VA correctly, so they bill the veteran. That's when the veteran comes to see me, and we work through the issues, make sure that the care was authorized, and then we solve that issue and have the VA make sure they reach out to the community provider, and the issue is solved, and the veteran goes away with a zero bill.
And Gary, I understand that a lot of these services are at no cost to the veterans out there in Texas. So why is that important and key in this process?
Well, thank you for that question as well. Again, the Texas Veterans Commission is a state agency created with the specific task of assisting veterans to obtain their VA benefits, and in some cases, state benefits that don't come through the VA. We value our partnership with the VA, and we wouldn't be able to do these things if we didn't have that partnership. But again, we try to make sure that they understand if you need something, reach out to the Texas Veterans Commission. We have trained professionals. That's why we've been successful as the Healthcare Advocacy Department. I have 24 individuals that are hardworking and driven, like Mr. Juarez here, and we focus on helping the veterans understand their benefits and getting what we can for them. The agency also has different departments, claims. If you have questions about your educational benefits, employment, entrepreneurship, the Texas Veterans Commission is a state agency that is here to assist veterans with the benefits that they've earned.
So many resources that we've had the chance to highlight with the commission. I do want to ask you though, you said this is a really uniquely Texan program. Is this a model for some other states to open advocacy departments as well?
That's a great question. We've had other states. We had conversations with Michigan. We had conversations with Oklahoma over the past 2 years. The unique advantage we have here in Texas, we've been working very, very closely with the VA for a number of years. I started out in our claims department, and a lot of our claims personnel are in medical facilities already, but working on the claims side. Several years ago, the legislature realized that there's been some concerns with the VA and healthcare. They put together our program. We've grown into a department since then, and we work hand in hand with the VA to provide another area of a resolution for the veterans who have these questions. We try to listen to them, as Mr. Juarez said earlier, and we also try to pay attention and answer questions that they don't even know to ask in some cases. But the Texas Veterans Commission is a state agency like others, but it's unlike others in a lot of ways as well. It's because of the hardworking people we have in my department and the rest of the agency.
Well, Gary and James, we so appreciate you shedding some light on this program, because maybe people out there may not know about it, but they can hopefully connect with you all if they need that kind of assistance. So thanks again for being with us.
Thank you very much, and they can reach out to us on the internet, www.tvc.texas.gov. You can click on healthcare. It'll show you one page of frequently asked questions, and it'll show you all of our locations as well, and information about the rest of the Texas Veterans Commission also.
Simple as that. All right, thank you again.
Thank you.